Now, Dr. Bob Gill is with us now because the COVID story is coming back. There's a plan A, though nobody quite knows what's in it. And there's a plan B, and the Labour opposition sometimes calls for a move to plan B, but sometimes sticks with plan A. It's all very bamboozling. Certainly the number of cases is going up, although the rate of increase has begun to fall. The number of hospitalizations also up. The number of deaths in Britain is up. And we thought we needed some medical attention to this issue. Dr. Bob Gill is himself, of course, a GP, but also a filmmaker whom we have interviewed many times about his great work in defense of the National Health Service. Dr. Bob, thanks for coming on the show on this subject this time. Tell us how you see the current picture of the coronavirus in Britain, if you would.
Thank you, George. Well, compared to our European neighbours, we seem to be the worst performing. That's because we're following a strategy of vaccination and nothing else, whereas other countries are doing a vaccination plus strategy, which is to leave in measures that mitigate the risk and the spread of the virus. So we're doing relatively badly compared to similar economies abroad. And we really have to start asking whether this is a competence issue, or does the continued chaos, the continued strain on the NHS provide some political advantage to this government?
But, of course, if you do a lot of testing, I myself did 2 tests in the last week or so. If you do, mercifully, both negative, but if you do a lot of testing, you're going to find a lot of cases. That's not in itself disastrous, is it?
No, but you're right. The cases may be going up, but the more important figure is the hospitalization rate. So there are thousands of COVID positive patients in hospital at the moment related to complications of COVID. Now that's having a devastating effect on the provision of services. We saw down in the southwest, a line of 20 ambulances waiting to drop off patients who are sick, who require hospitalization, but there are no beds for these people. And the decisions that the government made in the way it handled the pandemic, we recently heard that one of the private contractors they hired to do PCR tests had released 43,000 incorrect test results. So the pandemic response has been an expensive catastrophe from the beginning. Now, what advantages does the pandemic provide to the government? Well, it provides quite a few. It creates an atmosphere of fear. This atmosphere of fear allows them to bring in vaccine passports, which they can extend for other uses later on. It also shakes the confidence of the public and the staff in the NHS. They start to believe that this system can't cope. And currently through Parliament, we have the Health and Care Bill, which is going through, which is the final transition to an American-style managed care system. And all this chaos distracts from what they're up to with health policy. And what have they got to lose? They have a feeble opposition. They have a quiet legacy media. There's nothing to lose. There's no electoral loss, and there's no legal threat to them. We know that our politicians can implement disastrous policy that leads to mass preventable death. Sir David King estimated 100,000 COVID-related preventable deaths. Nobody's going to prison, because we have got something called Crown Indemnity, which protects our politicians who, in the course of their duties, inadvertently kill thousands of people.
Well, let's go back to the vaccination issue. We came up with the vaccine, Oxford AstraZeneca. We handled the rollout better than more or less everybody else in the Western countries, at least. The vast majority of us are vaccinated twice, and yet people are still getting it. Do you get the impression that the vaccine isn't quite what it was cracked up to be as a defense?
Well, it provided everybody with a great sense of hope because they saw the government wasn't doing anything else which would prevent the spread of the pandemic. But we've known, as soon as the studies became available, that although it modifies how sick people get, if you've had both vaccines, the chances of you dying from getting reinfected are very much reduced, but it doesn't prevent transmission. And the immunity you get from the vaccine starts to wane after a while, hence the push for the booster. So the vaccine was never going to be a cure-all, I'm afraid. So that's why other countries are following vaccination plus, a vaccination plus mitigation policy. And that's why we're doing so badly.
Well, you say we only did the vaccination, but that's not right, is it? We had a draconian lockdown. We had the closure of huge sections of our economy. Yeah, if we go back to that, the country will be ruined, surely.
Yeah, so the lockdowns were a testament to the government's failure to respond to this properly. They never had a sensible test and trace system. The system they had was hugely expensive, fragmented, and outsourced to an accountancy firm who has no experience in managing a pandemic. And people who were positive weren't supported to isolate. So it was a totally chaotic and very expensive system. The lockdowns were a testament to the failure that we had in response to the pandemic. There was some relief once the immunization program started to get rolled out. And you're right, we did very well. Again, the vast bulk of the work in terms of vaccinating people was done by the NHS. So the very institution that this government is set up to fail is the one that helped them out of a desperate situation. And lockdowns are an extremely blunt tool, which should never have been used, never have been needed, had the government followed rational, basic public health measures.
So what should happen now? I've just been in Europe. It's certainly true that more people are wearing masks there in the street and in big public places. It's true that if you wear a mask, you might not infect someone else or you quite so easily, but the mask doesn't provide very much in the way of protection either way. What else can we do?
Yeah, I think it's important to complete the vaccination program. Again, there are a lot of people, the vast majority are vaccinated, fortunately, over the age of 50. We've vaccinated the vulnerable groups. We know that the protection starts to wane. So there's a booster program which people who are in the high-risk groups should get along and get themselves topped up with the vaccine. But there are other mitigations. So we never attempted to mitigate the spread of the virus within the schools. Now, there are many pupils up and down the country who are getting infected and obviously taking this home to their families. So that's a problem that this government never addressed. And there are other basic public health measures that we haven't enforced. So that is the problem. And I believe there are political advantages in the eyes of this government for this to drag out and to perpetuate the climate of fear so they can bring in other legislative goals that have nothing to do with the handling of the pandemic.
Well, you say that, but the government has thrown money around like a drunken sailor, albeit into some strange pockets. £37 billion for track and trace, which has been, in some places at some times, an almost criminal fiasco. But the money that the Treasury has spent on supporting the economy, supporting companies, paying furlough and so on, that's not in the government's interest, is it?
No, but if you look at where this money is ending up, it's not ended up in boosting up the public sector. It hasn't ended up creating extra capacity within the NHS. It hasn't gone to support local councillors or councils in providing a response to all of this. It's gone to private corporations. And the Public Accounts Committee themselves said that the 37 billion that went to Serco, Deloitte, Test and Trace had no tangible effect on preventing the lockdown. So, one way of looking at this is we have a blatant looting of the treasury. Where is this money all going? These are the questions. What sort of a country are we living in where money goes in and there's no end product? That is the problem we have. The furlough scheme, yes, it was very expensive. It was necessary, but it's necessary because the government failed basic public health.
A lot of people find it difficult to compute what a billion is. If you made a billion into seconds on a clock, it would take 31 years of seconds for 1 billion. We spent 37 billion on the track and trace, and I'm one of those who believes that it would actually be impossible, even if the money had been spent well, and it wasn't, to expend that amount of money on anything really, certainly not on a track and trace.
Yeah, these are eye-watering figures, but just think what they refuse to spend money on. They refuse to spend money on supporting working class people to stay at home whilst they were isolating with the infection. They refuse to do that. For the whole, millions of people who are on precarious contracts, the gig economy, they never supported these people. So what did they do? They ended up carrying on working and spreading the infection. The money went to large multinational corporations who have done extremely well out of the pandemic. The vaccine that we all paid for the research for, the AstraZeneca vaccine, which was 97% publicly funded, the patent for that was given over to a private company. We're being ripped off, and people are dying as we are being ripped off. So this is the worst of all worlds that this government has dealt to the population.
So what do you expect, Doc, over the next week, 2 weeks? Are these numbers going to keep spiking, or might they begin to fall away?
Well, there may be a bit of a lull because we have a school half term at the moment across most of the country, so that might put a natural brake on things. But certainly the public health experts in Independent Sage are predicting that perhaps that we need another sort of circuit breaker event to slow down the spread of infection and to stop the overwhelming of NHS hospitals.
I don't think that the public, obviously anecdotal evidence is always dangerous, and the polls do indicate something different. But my sense is that people will not accept another lockdown. They will not accept another cancelled Christmas. They will not accept not being able to hug their mother. Is that your sense also or not?
I think people will certainly resent having to give up their freedoms, give up their social arrangements and restrict their movements, no doubt about it. People are fed up, and that's why we're seeing the sort of booster program stalling in this country, because people are fed up with the restrictions they've had to endure. But that doesn't mean it's the wrong thing to do. But what price will this government pay? We have a totally absent opposition. There is no political price for this government to pay.
Fair point. Dr. Bob Gill, thank you very much indeed for joining us